We dental professionals don't get a lot of praise or thank yous for the work that we do. Fixing an active toothache or seating veneers are some of the procedures where we might get an enthusiastic thank you. But most often, thank yous can be few and far between. As a hygienist, one of my most favorite services to provide for a patient was to place a desensitizing liner on an exposed root surface. It is one of the few things I did that got an immediate positive result for the patient. I love the thank yous and the pleasantly surprised happy patients that something so easy could immediately improve their quality of life. I even got a few hugs. 1 in 8 participants from a general practice study had dental hypersensitivity, according to data in March of 2013. Fluoride varnish treatments and home fluoride prescription toothpaste can help. But for those with receding gums and exposed root surfaces, it might not be enough. For those patients, I used Brush and Bond by Parkel because it was so easy and quick to use with immediate relief. You know, all those patients that when you rinse the mouth, they have recession on a few teeth and they grab the dental chair real tight. Those are the patients I present the option of getting a coating in place to relieve the issue. Of course, the patients immediately ask how much does it cost? And I answered $40 per tooth and they would usually refuse. My doctor allowed me to treat their most sensitive tooth for free just to let them try it out. Once I could rinse that tooth with no reaction, they saw how easy it was to place. They wanted their other teeth done as well and had no problem paying the $40 per tooth fee. I did tell the patient we would submit the fee to their insurance. We used code 9911 and they would probably have a 30% chance of getting it covered, but don't count on it. Then I would told them that we would reimburse them or credit their account if it was covered. That way they knew payment was expected today. The question I get asked the most is, what if it pops off? Do you replace it? I always told my patient if it popped off in the first 8 weeks, I would replace it for free with no need for an appointment. I did expect it to last 6 to 12 months. I would tell them, think of it like a semi-permanent band-aid that didn't need to be replaced as often as they get their hair cut or colored. That would put it into perspective and it made it worth it to them. I would tell them to think of it like a semi-permanent band-aid that didn't need to be replaced as often as they get haircuts. That would put it into perspective and it made it worth it to them. A lot of these patients had recession or an abfraction due to grinding their teeth at night. As a doctor made that assessment as well, we educated the patient on the benefits of a night guard. We wanted them to know the cause of the sensitivity and an easy way to stop it. So let's do the production math. 1 patient a day with 3 teeth that need treatment at $40 each. Multiply that by 16 days a month and you get $2,000. Multiply by 12 months and you get another $23,000 per year. Let's say half of those could use a night guard too. 8 patients a month to be conservative. $300 per night guard equals $2,400 per month. Times that by 12 months, almost $30,000 more a year. Together you can reduce patient sensitivity, increase their quality of life, and increase hygiene production by almost $60,000 per year in those 2 services alone. Help your patients feel better and appreciate you more. At a minimal cost to them, start offering solutions for sensitive teeth that work better than home fluoride. That's it, guys. If you have any questions, shoot me an email.